Let's talk about sex, baby. Let's talk about you and me. Okay, I don't have an awesome voice, but we're going to talk about something today that a lot of people are uncomfortable to talk about, and that's sexual wellness. Serena, I want to start with the clinical understanding of when you think of sexual wellness or you're counseling your patients on what that really means.
So that means that they enjoy sex, that they're not having pain with sex, and they don't have any concerns. A lot of sexual wellness is actually defined by the person themselves. And the hard part about that is it's so hard just to have that conversation. I had a patient the other day who told me she wasn't having sex with her husband because she didn't have time. And if I had let it go at that, that would have been enough for her because she was seeing me so she could make a baby. But I asked her, well, maybe you don't have time, but maybe you're also anxious about it. Maybe it's making you uncomfortable, and maybe we should talk about that. And she did say, that I am uncomfortable, and that to me means like she needed help with sexual wellness. So it's very, very personal, very personal.
It is so personal, and if you haven't felt comfortable even opening up to your girlfriends, making the leap to like opening up in your relationship, asking for what you want, learning your own body. There's so much history that goes into this, right? With religion, with culture, with sort of family shame. I think I hear so many stories that it's so heartbreaking. I did this workshop that I was at in which out of 100 people, men and women included, only 2 could report that they didn't have a sexual trauma.
Wow.
2 out of 100. So 98 out of 100 people.
We're all walking around pretending that our sex life is normal.
Yes. And pretending
for ourselves and to everybody else.
Totally. Yes. And that's a big pretense in a relationship, right? Like you get into a new relationship and you don't want to come off as damaged. You want to come off as attractive. You want somebody to desire you and to want you. And then you don't know when a trigger might occur. Right. I mean, and it's how do you say like, ouch, that hurt, and then not have it affect the other person. I feel like as women, we do that a lot where we try to protect their feelings over our own experience. Yeah. We're like, I don't want to speak up and say this because I don't want to be emasculating.
Right. But it is true. It's sensitive for guys too. So how do we make everybody comfortable? And the hard part is, a lot of times your gynecologist who's the first person you would think to ask about stuff like that, may not have had a lot of professional training in sexual wellness. Like we know, the anatomy, we know how to do surgery, we know how to deliver babies, we know how to correct very specific medical issues, but sexual function for both men and women, and especially for women, involve a lot more than just your parts, the vagina and the uterus and the ovaries. There's the hormones, there's all the things that happen in your head. There's cultural and societal issues. And then, of course, like you said, your history. Like, is there any trauma? Or maybe not even trauma. Maybe just, maybe your parents didn't talk about it and it was just like kind of taboo and uncomfortable. So it doesn't have to be anything dramatic, but that doesn't necessarily mean you're comfortable.
If I'm like in thinking about this and I'm going, okay, if I was evaluating my physical wellness, I would get a physical. If I was evaluating my fertility wellness, I would get labs and tests and things like that. How do we evaluate our sexual wellness? Kind of, if I'm like, sort of like, or maybe, or somebody's like, well, it could be better, but am I thinking about it in terms of like, am I turned on enough? Do I have enough lubrication?
Oh my God, so much to talk about. So, and we have all these ideas about what is good sex, and a lot of it is defined by like Hollywood and Netflix and things like that. And that stuff is what on TV is not
with your head. Oh my gosh, we got perfect orchestrated sex, right? Yeah. I mean, directed sex, and it's not real, people. It's not real.
Yeah. So there's so much to talk about, and we actually, Alice and I, have talked about this a lot because this is something that we really feel very strongly about. That is a huge need that people have, and our society, our healthcare psychology, psychiatry, social work, society, we're really not supporting people in sexual wellness very well. And so people have all these questions about what is normal and what is real. And that's part of why I'm doing this conference this weekend, and that's part of why I got Alice to talk about it, because I do want you to think about coming to this conference this weekend. It's called Women of Sex Tech, and we'll give you all the information, but it's on Saturday. It's a virtual conference, obviously, but it's about a lot of different things revolving around sex, and not just what I do. I do one form of sex tech, which is I make babies in test tubes, and I, of course, going to talk about that, but there's also talk about sex positive porn and even sex toys and the business of sex tech and things like that. And even this conference is focused on sex tech and is very female based. So it's a safe space, because that's often an issue in sex, is that for women, we need to really feel safe. But that's really, even though we're doing a very cool conference this weekend, and there's going to be tons of awesome speakers, it still doesn't cover everything. Like Alice and I are thinking, we're going to have a bunch of conversations about this. So don't worry if we haven't covered what you want to hear about sex.
Right.
This conference, you're gonna tell Alice, like, give us feedback, like, what are the topics? Because we just, in the few minutes before we started, we came up with like 20 topics we want to talk with you about.
So it's probably going to be a 6-part series. And when we think about the world that we come from, which is infertility patient advocacy, and you think about all the medical procedures somebody's going through in order to make a baby with somebody like Serena, it does take some of that sensuality and out of the equation sometimes. And we want to help people put it back in, because the sensuality and the physical and emotional intimacy can thrive even in the face of something that's so cool.
But it has to be conscious. It does have to be conscious, because it's easy for that to get buried under.
It absolutely
is. You have to do.
Especially when we're doing injections, and as a woman, we feel so bloated. We hear a lot from the men who feel so helpless, right? And so you have things that are tied into, like, a woman, not feeling attractive, not feeling sexy, and then
that weighs on your head.
And that just weighs on our head and kind of plays tricks with our psyche. But the flip side is with men, when they feel so helpless, and that plays with their psyche, right? And the input being, feeling emasculated. And so this is to open a dialogue. And we don't have all the answers, because it's not one size fits all. And it really is so unique to the couple, but it starts with the individual and, being comfortable to ask these questions. The Fertility Answers app is definitely a safe place to ask some of these questions and to start bringing it up. You can put them in the general channel, and we'll have some specialists available. But I think the key is actually, honing in on this conference that Serena is speaking at this weekend. So we'll identify all the information. There's an Eventbrite or a URL that we can include?
It's an Eventbrite. It's free. It's like 11 a.m. to 5 p.m. I'm actually talking right at 12 noon. And right before me is a cool talk on sex toys. We have a sexual psychologist. We have, it's sex positive porn, COVID-19 and sex. So there's navigating intimacy for couples with kids during lockdown. So there's actually a lot.
That's a good one.
Lots
of tricks.
Yeah, cool stuff. So we hope that this, and in this group, Women of Sex Tech, hopefully creates a positive space for you to get a lot of resources, because if you do have concerns about sex, there's huge resources here. All these women, this is what they do, is try to help people be comfortable with sex. So
I think it's fantastic. So we will throw all those links in for you, so you can make sure that you attend this weekend, and I'm sure it'll be recorded. So if register, and even if you can't attend all the sessions, I'm sure it's going to be recorded.
You're right. Yeah.
Keep bringing you product reviews, data. Look, this is a safe place. We're not going to be like giggling, like, oh, the vibrator, like this is, we're all adults here. And this is something that really needs to not be taboo. And there's no shame in discussing sexual wellness. We'll also be covering oncofertility and kind of my experience being in medical menopause. and what that experience was like as it relates to a lot of
topic I'm so passionate about is that, you know, cancer, we have so many cancer survivors and thrivers. And Alice, you're like a huge example of that. Obviously you're thriving and yet you had cancer. And so quality of life and sex is a huge, reproduction and sex are two separate but related things.
Right.
So important in your post-cancer life.
And I have some funny stories for people. So keep tuning in to Monday Motivations for the next, for the next 4 to 6 weeks. We're going to be doing this sexual wellness series, and we hope you'll come back and see us. Find the links below.
Because sex is so much more interesting than COVID-19. I mean, I think
massively more interesting. So much more to talk. Hey, we know so much more about sex than we do COVID-19.
There you go. Yeah.
So there you go. Thanks everybody for tuning in. I'm Alice Crisci, CEO, co-founder of MedAnswers and the Fertility Answers app, with my dear friend Serena H. Chen, and I am from IRMS St Barnabas, and we'll see you next week.